Doctor, let's talk about hormones a little bit and what role can they play in cancer and cancer treatments?
Yeah, probably a mixed answer to that right now. I think that a lot of the mainstream ideas are if they're hormonally sensitive tumors, and we're finding that not just breast cancer and prostate cancer being hormonally sensitive, but there's a lot of other tumors that are hormonally sensitive. And I think the more we investigate that, the more we'll see that. Then the question becomes, well, if somebody has a progesterone receptor on a breast cancer, well, does that mean that progesterone is going to be a problem for that person? Will that stimulate the growth of that tumor? And there's literature that I'm finding that actually doesn't support that, where progesterone by itself as a natural hormone actually causes cancer death, cancer cell death or apoptosis. So then, well, do we give progesterone? And then there's an argument to say, well, we can stimulate progesterone receptors by giving estradiol. So how safe is that? So I don't know what the true answer is. That somebody else asked me that earlier today, and I'm like, well, I'm not 100% sure because I'm sort of on that edge going, well, we've seen good results with people getting estrogen blockage, and then we look at their 24-hour urine and see what their actual breakdown is and why they're not biochemically processing their hormones. And then we've also looked at giving patients with ovarian cancer 2-methoxyestradiol.